Hello everyone, welcome back. This is NainaMD, Fusion of Science and Beauty. And today I want to continue on with another guest. She's very phenomenal. Her name is Christina Cowger, and she's here to discuss about a topic that you might not really know about, and that's neurotransmitters. She's been a licensed therapist for almost, is it 12, 13 years now? Neuroscience is a company that I came across almost 20 years ago with Dr. Kellerman, who first introduced the concept of how neurotransmitters in our brains, right, can actually cause imbalances, which can lead to anxiety and depression. And we are in an a whole epidemic of anxiety and depression. Everywhere we turn, people have either anxiety issues and depression issues. I want to welcome my guest, Christina Cowger. How are you?
I'm good. Thank you for having me, Dr. Naina. And it is an exciting topic, and it's quickly evolving.
Yes.
I've been with neuroscience for 10 years. And one of the phenomenal things about neuroscience is that the founder, as you mentioned, Dr. Kellerman, is dedicated to research and development. And so that's led to an evolution in the science. It's led to an evolution in the understanding. And what we know when we talk about neurotransmitters are that neurotransmitters are the communication system of the nervous system.
That's right.
And we have neurotransmitter activity all over our body. And just like with the immune system, cytokines are the chemical messengers, and with the endocrine system, hormones are the chemical messengers. Neurotransmitters are the chemical messengers of the nervous system.
And it's almost like, and when you talk about chemical messengers, it's like neurotransmitters are little, you can say there's almost like a chemical that goes in your brain, okay, and gives you a certain emotion, or it can have an effect, so to speak. So, for example, what are some of the common neurotransmitters? We have, I think, about over 200 neurotransmitters, right?
We have quite a few neurotransmitters.
We have a lot of neurotransmitters, guys, believe me. But we can't really measure all of them, and that's been the limiting factor. So Dr. Kellerman and the company Neuroscience, which is amazing, started to try to measure, or at least try to figure out what is happening in our bodies, and being able to measure some of these neurotransmitters, right?
That's correct. And just, looking at the neurotransmitters, as you know very well, the body is an interesting symphony. The endocrine system doesn't live outside of the nervous system. The immune system doesn't live outside of the nervous system. And so for a long time, and I think this is evolving as well, and you're at the forefront of it, is we can't segment off different aspects of the body.
Exactly.
So when we look at neurotransmitters, yes, we're looking at the nervous system, but the beauty of neurotransmitter testing and looking at a report, while it's not diagnostic, it's giving you an incredible amount of information. The information that you can glean from a neurotransmitter test, you can look at keys and trailheads into, is there something going on in the immune system that's at the root cause?
Exactly.
And we see this a lot when we look at chronically ill patients. I'm up in the Bay Area. We have quite a bit of Lyme disease. And I was recently meeting with a doctor who treats Lyme disease, but he's wound up getting patients who come in presenting with anxiety, depression, sleep dysregulation.
Right.
Was that their leading issue? No, the immune insult was. And through the neurotransmitter testing, we were able to not only address the depression, the anxiety, and the sleep issue, but we were able to get clues to how impacted that immune system might be and how it was influencing the nervous system. Yeah. So what I guess the bottom line is, it's an orchestra.
Yes. And also I feel before, and I do a lot on hormones. I lecture a lot on vitamin hormone replacement therapy, but we know that it's really the neurosystem, right? The nervous system has an effect on the endocrine, which has an effect on the physiological system. They're interrelated, but ultimately I realize you have to have the neurotransmitters being balanced to achieve that optimum balance, so to speak.
Addressing the neurotransmitter balance or imbalances can have a trickle down and a trickle up effect in the body.
Exactly.
For instance, it's been more recently that pharmaceutical has been developed and marketed for women who are menopausal and experiencing hot flashes. So right there we see the connection between modulating, let's say, one of the neurotransmitters, serotonin, right, and influencing what we normally may have looked at in the past as symptoms that were indicative of a hormone imbalance. Yeah. We now realize that if we address the nervous system, we can reduce what have in the past been looked at as hormonal imbalances.
Exactly.
And I'm imagining in your practice, the key is always, we want to give the least amount of exogenous hormones, for instance, and have the most impact. And the way to do that is to combine supporting the endocrine system, as I'm sure you do with your patients, and then bringing in this nervous system piece to dampen down some of those negative effects that people are experiencing.
So, you know, you were saying about like how pharmaceuticals are you know, being used for like hot flashes, like antidepressants. Most serotonin reuptake inhibitors are being used for stopping hot flashes. But it would be really nice to be able to, and for the audience to realize, is that there are other options, more natural options. And that's why I wanted to bring you on to say that it's amino acids. Amino acids can sometimes help with balancing of the neurotransmitters, so that you can help with hot flashes, you can help with anxiety, you can help with depression, and maybe we can avoid having to go as a first choice to an antidepressant. As a first choice, look at what we call targeted amino acid therapy.
Exactly.
Right?
And when we look at the neurotransmitter testing, women may walk in your door thinking that their symptoms are only hormone related, and the testing can give you clues. You know, this midlife is a real collision point. As estrogen declines, we become more inflammatory. The immune system starts to shift. So if somebody's had a low-grade infection or any kind of immune insult or food allergies, and they meet this collision point, when you run the neurotransmitter test, you're going to be able to look at things like the hormones. If you do a neuroendocrine, you're going to look at adrenal status. When we go into perimenopause and menopause, we know our body's going to start relying on those adrenals more, so we want to look at adrenal status. So the test is a beautiful inroads to say, is there an underlying immune issue? Can we just dabble in the serotonin piece and make this person sleep better and be more comfortable with hot flashes? Or is there something else going on? And the testing can give you the trailhead.
Exactly.
And that's not a cookie cutter approach. That's a very customized, personalized medicine approach.
Exactly.
That one test can open you up to understand. Some people it really just is support GABA, support serotonin, and off they go. For other people, it's deep adrenal support. There may be other neurotransmitters.
Or they may need dopamine support.
That's right.
Or whatever. Yeah.
And one thing I'll just mention quickly to highlight what you're talking about is in the field of therapy and psychiatry now, a lot of these old seizure medications have been brought back into the forefront. For instance, Lamictal is a drug that's been widely prescribed. And you know, when I hear somebody come to me and say, you know, I was on an SSRI and then I added in this, it was miraculous. Well, maybe it was for some reason, but that also might point to the fact that if a drug like Lamictal is modulating glutamate, which is neurotoxic and excitatory, then you might want to look at that neurotransmitter test to say, hey, is there anything else going on in this person's immune system that we can use some of these targeted approaches with and dampen down?
Exactly. No, I think that is, I'm so glad you were able to come today and just educate people on, you know, just what a neurotransmitter might be. By the way, neurotransmitter, again, is simply a chemical messenger. Okay, just like a hormone is you just need not a whole lot of it, but it's a chemical messenger that provides just so to speak fuel for the brain in a way, and has an effect on your mood. It can have an effect on your mood, just as foods, just as many other things can interplay. Give me an example. Before, I know time is running out. Give me an example of a patient, a client, or just a story. Just tell a story of someone, a real story of someone who benefited from a test, and realizing again, in conventional medicine, loves to take things out of context. So if I start talking about neurotransmitters, like, okay, that's the only thing we look at. No, we're looking at other things. But so tell your story in that context.
That's right. Well, again, it's a blueprint. It's kind of a fingerprint of that individual. Exactly. It's to look at not just numbers. It's looking at ratios. It's looking at function.
Exactly.
And one example that pops out in response to your question is when, and this may not be the exact population, but I think it highlights what we're talking about, and that's when a child presents or a young adult presents with ADD or ADHD. And it's fascinating when you take populations of children that have been put on, let's say, Adderall, for instance, a high dopamine, just as one neurotransmitter as an example, and a low dopamine, behaviorally might present in the same exact way.
Exactly.
So which child that goes into their psychiatrist and gets a prescription for Adderall is going to get blown out of the water and not have a good result, versus which one it might just dial them in. And that, in a lot of ways, if we're just going by symptoms and we're just going by presentation, high and low numbers can sometimes present in the same way. And without having some sort of a tool to understand which side of the equation that child, or for instance, when you're working with women, is on, that's a lot of guesswork that you're going into, and it's putting people in precarious situations.
Absolutely.
And this gives you a lens to look through to at least be slightly more selective in approach.
And you know what? That's exactly what I've done when I've worked with people with ADD. And you're absolutely right. The one medication can have a very severe negative effect, yet on another person have the most amazing positive effect. And that's why there's such a discrepancy of results.
That's right.
Listen, where can people look up neuroscience and like try to even look at maybe doctors who might be doing this testing, or practitioners or licensed therapists and so forth who do this kind of testing? Where can they go? Which website and so forth?
You can go to neurorelief.com. Neuroscience has quite a few resources. You can find doctors, referrals of doctors who've gone above and beyond and have gone through different certifications at neuroscience office, different educational modules, so that you really know somebody you're getting has actually done this and has done the extra footwork and the extra study. So that's one resource. We also have a YouTube channel, which at the end we can put up for people to visit. There's quite a few webinars, and there's also quite a few YouTubes that people can go to hear different doctors speaking, different case studies that might be of interest as well.
I'm so glad you were able to come onto the show, and I think this is just, I'm definitely going to bring you back, because this is an introduction to everyone. I don't think people have even heard about neurotransmitters or how neurotransmitters could possibly improve me, and maybe I could balance them in a more natural way. And we haven't even had time in this show to even talk about some of the amino acid therapies, right?
That's
the
really
key
exciting to see
that's
how we're going to.
That's the most exciting part of my practice, and that's what got me so motivated when Dr. Kellerman and into the biochemistry. When I started reading about it, it was amazing how certain neurotransmitters,
can be impacted.
Exactly.
And one last quick thing, I mean, what we do hear about a lot now is genetics. And when we think about even some of the genetics related to behavioral health, when we're looking at neurotransmitters, we're looking at what's the end result of what your body does with the genetics you have. So you're seeing how the rubber hits the road.
This is a topic, by the way, for the next time.
Good.
Okay?
Excellent.
Thank you so much.
Thank you.
Everyone, this is NainaMD. I hope you enjoyed the show, and I'll see you next week. NainaMD, Fusion of Science and Beauty.